If you're over 50, please don't scroll past this video. It could literally save your life or the life of someone you love. Pancreatic cancer is one of the deadliest and most silent killers in the world. By the time most people even realize something's wrong, it's already too late. Often referred to as the shadow of death, pancreatic cancer hides in plain sight, masked by subtle, easily ignored symptoms. But here's the truth. Recognizing these early warning signs, especially if you're over 50 or 60, or if you have risk factors like smoking, diabetes, obesity, or family history, can lead to earlier diagnosis and dramatically increase survival rates. In this video, we'll walk you through 10 early signs of pancreatic cancer that most people overlook until the disease reaches an advanced stage. These signs aren't always dramatic, but they are crucial. If you or a loved one are noticing subtle changes like unexplained weight loss, persistent fatigue, digestive issues, or skin and urine changes, you need to pay close attention. Whether you're in your 50s, 60s, or caring for aging parents, this message is for you. Understanding these symptoms now could lead to life-saving early diagnosis. If you value health-focused content that could make a real difference, subscribe to our channel and share this video. It helps us grow, reach more people, and potentially save lives. 1. Unexplained weight loss. A hidden clue you can't ignore. Have you recently lost weight without trying? More than 5% of your body weight in just a few weeks or months? While many people welcome weight loss, unintentional weight loss can be an early red flag, especially if you're over 50. In pancreatic cancer, tumors often interfere with the pancreas' ability to produce vital digestive enzymes, meaning your body can't properly absorb nutrients, even if you're eating normally. Instead of fueling your body, it begins breaking down fat and muscle, leading to sudden, unexplained weight loss. According to research from the National Cancer Institute, unexpected weight loss is one of the earliest symptoms of pancreatic cancer, sometimes appearing months before diagnosis. So if the number on the scale is dropping and you haven't changed your diet, exercise, or routine, especially if it's paired with fatigue, digestive issues, or loss of appetite, this isn't just something to brush off. It could be your body sounding an alarm. Don't wait. Talk to your doctor and ask about deeper testing, especially if you have additional risk factors or are over the age of 60. Early intervention saves lives. 2. Persistent loss of appetite. When food stops feeling right. Loss of appetite is something most of us write off as stress, fatigue, or just not being in the mood to eat. But when it's sudden, persistent, and paired with other digestive symptoms, it can be a major early warning sign of pancreatic cancer. As pancreatic tumors grow, they can disrupt both hormonal balance and digestive functions, creating a sense of fullness or nausea even after just a few bites. Many people start feeling repulsed by rich or fatty foods, which leads to reduced calorie intake, nutritional deficiencies, and a dangerous decline in energy. This symptom is especially common in adults over 60, but it's often dismissed as just part of aging. Don't make that mistake. If your appetite has noticeably declined for more than a few days, or if you feel full quickly, struggle to eat, or start skipping meals, you need to take it seriously. Especially when paired with other symptoms like weight loss, nausea, or bloating, this could point to underlying pancreatic issues. Don't assume it's harmless. Talk to your healthcare provider and ask the right questions. Your awareness might lead to early detection, which can make all the difference in outcome. 3. Dark urine, a silent signal from your body. Dark urine might not seem serious at first glance, but when it becomes a persistent change, especially when it looks dark brown, amber, or like tea-colored urine, it could be a critical early clue of pancreatic cancer. This symptom is often caused by a tumor in the head of the pancreas that blocks the bile duct, preventing bilirubin, a waste product your liver usually flushes out, from being properly released. As bilirubin builds up in your body, it leaks into your urine, causing it to darken. While dehydration or medications can also cause darker urine, pancreatic-related bile blockage often shows no pain, making it easy to miss or dismiss. However, if this symptom continues for more than a day or two, especially in people over age 60, it could signal something far more serious. Combine this with other signs, like itchy skin, pale stools, or fatigue, and you're looking at a potential early warning system for something you shouldn't ignore. If you notice these changes, especially if you're in a high-risk age group, don't wait. Ask your doctor about liver function tests or imaging scans. Early testing could catch pancreatic cancer at a treatable stage. 4. Itchy skin, the strange symptom that could be serious. Itchy skin is one of the most overlooked and misunderstood early symptoms of pancreatic cancer, especially in older adults. If you're experiencing persistent, unexplained itchiness all over your body, and it doesn't respond to moisturizers or allergy medications, it may be time to look deeper. Just like with dark urine, the culprit here is bilirubin buildup. When a pancreatic tumor blocks the bile duct, bilirubin can accumulate in your bloodstream and begin to irritate nerve endings in the skin, causing intense itching without any rash or visible cause. This type of itch often appears before jaundice and can worsen at night. It's common in people over 65, but is too often brushed off as dry skin or aging. If the itching is widespread, continuous, and paired with dark urine, pale stools, or fatigue, it's time to speak with a healthcare provider. These signs can point to bile system obstruction and potentially early-stage pancreatic cancer. Early detection is critical. Don't downplay your body's signals, especially when something feels off, but you can't explain it. Sometimes the subtlest symptoms tell the biggest stories. 5. Jaundice, a visible red flag you should never ignore. One of the most visible and urgent signs of pancreatic cancer is jaundice. If you, or someone you care for, notice a yellowing of the skin or the whites of the eyes, it's a major red flag that demands immediate attention. Jaundice occurs when a tumor blocks the common bile duct, causing bilirubin to build up in the blood. This doesn't just cause yellowing. It often comes with pale stools, dark urine, and itchy skin, creating a pattern of symptoms that point directly to bile system obstruction, often linked to cancer in the head of the pancreas. Here's why this is so serious. In adults over the age of 60, jaundice without pain, known as painless jaundice, is often one of the first signs of pancreatic cancer. According to medical studies, any sudden onset of jaundice in older adults should immediately prompt advanced imaging tests like CT scans, MRIs, or endoscopic ultrasounds. Don't assume it's a liver issue. If jaundice appears, especially when painless, it's time to act fast. Pancreatic cancer survival rates improve drastically when it's caught early. Spotting jaundice early could lead to diagnosis at a treatable stage before the cancer spreads. This symptom is your body's visible SOS, don't ignore it. 6. Swollen gallbladder, a hidden but telling clue. While some signs of pancreatic cancer are visible, others hide deep inside the body, and one of the most overlooked is a swollen gallbladder. You might not feel it, but this can be a critical internal indicator of bile duct blockage caused by a tumor. This condition, known as Courvoisier's sign, occurs when a tumor in the head of the pancreas prevents bile from flowing from the liver to the intestines. As bile builds up, it inflates the gallbladder, sometimes without any noticeable pain at all. For many people, the first clue comes during medical imaging for something else, like abdominal discomfort, bloating, or digestive changes. But in adults over 60, especially those already experiencing jaundice, discovering a swollen gallbladder is a major diagnostic clue that pancreatic cancer could be developing. Research shows that when imaging like ultrasound or CT scans reveal an enlarged gallbladder in combination with other early symptoms, it significantly increases suspicion for pancreatic tumors. So if you're experiencing persistent upper abdominal pressure, loss of appetite, or you've been told your gallbladder looks swollen, don't ignore it. Request further testing, especially if other symptoms are also present. This hidden sign could be the missing piece that leads to early detection and better treatment options. 7. Blood clots, a silent and dangerous clue. Most people don't associate blood clots with cancer, but they absolutely should. In fact, unexpected blood clot formation, especially in adults over 60 with no prior history of clotting issues, can be one of the earliest signs of pancreatic cancer. This condition, known medically as venous thromboembolism, VTE, can include deep vein thrombosis, DVT, usually in the leg, causing swelling, redness, or pain. Pulmonary embolism, PE, a dangerous blockage in the lungs, often presenting as chest pain or shortness of breath. But what causes it? Pancreatic tumors release procoagulant substances that increase clotting in the bloodstream, sometimes months before a cancer diagnosis is made. That's why sudden clotting, especially in people with no clear risk factors, should raise serious concern. If you or someone you love experiences a swollen leg, unexplained calf pain, or sudden shortness of breath, don't just treat the clot, ask why it happened. Doctors often miss the underlying cause if pancreatic cancer isn't on the radar. This is especially important for those over age 60, or with family history, diabetes, or other risk factors. Catching the connection early could make a life-saving difference. 8. Nausea and vomiting, more than just a stomach issue. We've all felt nauseous before, but if it's persistent, recurring, and especially if it worsens after meals, it could be much more than just an upset stomach. Chronic nausea and vomiting can be an early symptom of pancreatic cancer, often caused by a tumor pressing on nearby organs. As the tumor grows, it may obstruct parts of the digestive system, such as the stomach or duodenum, leading to food not being digested properly. The result? Feeling full after a few bites, nausea that doesn't go away, vomiting undigested food hours after eating, bloating and indigestion-like symptoms. While these signs are common in older adults, they're frequently brushed off as acid reflux or age-related digestive changes, which can lead to dangerous delays in diagnosis. But here's what you need to know. When nausea and vomiting persist longer than a few days, especially in people over 60, or if they're paired with unexplained weight loss, fatigue, or appetite changes, it's time to dig deeper, literally. Imaging like a CT scan or upper endoscopy could uncover a tumor before it spreads, leading to earlier and more effective treatment. Don't settle for surface answers when your body is asking for help. 9. Loss of appetite, a subtle yet serious symptom. A fading appetite might seem harmless at first, but when it's persistent, unexplained, and accompanied by other subtle changes, it could be one of the earliest symptoms of pancreatic cancer. People often assume appetite loss is due to stress, aging, or fatigue. But research shows that up to 80% of pancreatic cancer patients report a progressive decline in appetite well before diagnosis. Why does this happen? A growing tumor in the pancreas can disrupt both hormonal signals and digestive function, making food seem less appealing and creating a false sense of fullness, even after small meals. Common signs include no longer craving meals you once enjoyed, eating far less than usual without feeling hungry, fatigue or weakness due to undernourishment. This is especially important for adults over 60, where even a gradual decline in eating habits should never be dismissed. If this is combined with weight loss, nausea, or digestive discomfort, it could be your body signaling something deeper. Don't chalk it up to just getting older. Appetite is a direct reflection of how your body's systems are functioning, and when it changes without reason, it deserves a closer look. 10. Abdominal and back pain. Pain that shouldn't be ignored. Persistent pain in the upper abdomen or mid to lower back can be more than just muscle strain or indigestion. It may be a critical warning sign of pancreatic cancer, especially when it doesn't go away with rest or typical treatment. This type of pain is often described as a dull, gnawing ache or pressure located in the upper stomach, radiating to the back. Worse when lying down or after eating. Slightly relieved when sitting forward. So what's causing it? As a tumor grows in the body or tail of the pancreas, it can begin to press on nearby nerves and organs, causing referred pain. This pain is commonly misdiagnosed as ulcers, back issues, or gallbladder problems, which can delay proper testing. Studies show that in older adults, especially those over 60 to 65, this kind of unexplained abdominal back pain is one of the most under-recognized early signs of pancreatic cancer. If you or someone you know is experiencing this pain, especially if it's new, persistent, and paired with other symptoms like appetite loss, weight loss, or fatigue, ask your doctor for imaging tests like a CT scan or MRI. This is one symptom you should not ignore. Early detection gives you more treatment options and a fighting chance. Thank you for watching. If you made it this far, it means you truly care about your health or the health of someone you love, and that alone could make a life-changing difference. Pancreatic cancer, often referred to as the shadow of death for a reason, but you now know the early warning signs that many people miss. This knowledge is power. And when it comes to something this serious, awareness is the first step to survival. If this video helped you learn something new or opened your eyes to symptoms you hadn't thought about before, please hit the like button. It really helps this video reach more people who might need it. If you would love to see content like this, subscribe and turn on the notification bell so you never miss a video. Have you or someone you love experienced any of these symptoms? Let us know in the comments. We read every one, and your story might help someone else feel less alone or get the help they need. Lastly, please share this video with friends, family, or anyone over the age of 50. You never know who might be ignoring the signs. Because when it comes to pancreatic cancer, early detection saves lives.